So in public health, we look at climate change health impacts. So what are some of the hazards? Who's going to be impacted? Where is it going to happen? And when is it going to happen? So these are just some of the examples across Ontario, the expanding vector-borne disease range because of our warming climates, more severe weather events. But we already know that we've seen changes because of climate change and climate variability over the last few years. So heat health risks, we know we're going to get more extreme heat events, and the concern with that, there's hot days and hot nights, and if people don't have an opportunity to cool down, you're going to increase extreme heat-related deaths. And not just the heat-related deaths, but in the last bullet here, other things that go with that, a lot of studies that show increased violence, stress, and poor mental health that are associated with that. And there was a bit of a discussion about air pollution. In Canada, there's approximately 14,000 premature deaths every year from air pollution emitted from human activities. So we mean things like industry, from fossil fuel production, from traffic-related air pollution. Vector-borne disease, we talked about as well. There was 6,000 human cases of Lyme disease reported across Canada between 2009 and 2017. Extreme weather events as well. So there was over 195 disaster-related extreme weather events that was reported by the Canada Disaster Database. And almost, this was mentioned earlier too, 500,000 people across Canada were evacuated because of wildfires between 1980 and 2017. Food safety and water quality. So this stat I got, that over 4 million Canadians are affected by foodborne illness annually, not all related to climate change, but because of climate change, we may expect to see more, because of contaminated water supplies, for example, you could have more foodborne illness, and warmer temperatures. We see more foodborne illness in the summertime. And food insecurity. We already know that there's many communities across Canada that are already experiencing food insecurity, and obviously water insecurity, boil water advisories across the north, and especially in some First Nations communities. And we know that climate change could affect the availability of food sources, especially in the north, and mental health. So this was brought up earlier as well, but when I was doing some of the research, it was interesting that it's not just those extreme weather events. So someone that has experienced a flood, a fire, having to be evacuated, that obviously causes extreme anxiety and stress. But it's also those incremental changes. So rising sea level, if you're living on the coast, more drought that we might be expecting are also going to be causing some mental health stress and anxiety. So we know that the Canadians that are most vulnerable to climate change are people on low incomes, older people, children, Indigenous people, those living in the north, and people that are already experiencing health inequities. It varies. So we know in cities, urban heat islands effects, you've got more concrete surfaces, so you might have more hotter temperatures in cities, and more air pollution because of traffic-related air pollution, more flooding of storm sewers, and you might have a vulnerable population, whether it's aging populations or one of the others in the rural communities. When I think about urban populations, we have to look at the demographics. Is it new immigrants? Is it some of the marginalized populations that are going to be more impacted? Some of the impacts to the north that was Courtney spoke quite a lot about, the melting permafrost, thinning sea ice. So the food that traditional communities would be relying on won't be available any longer, and it'll be dangerous to travel to try and get that. And across Ontario, some of the things that we were seeing there is more flooding events, more extreme heat events, and more precipitation and vector-borne diseases that we would see in that area. And another one, high UV exposure, increasing skin cancer risk. But one of the things that local health units are doing across Ontario, they're now mandated to assess climate change health impacts in their local communities and look at what the impacts are today and in the future, and how well communities are adapted to address the health impacts. We can talk about solutions and some of these co-benefits. If we put some of these solutions in place to mitigate greenhouse gases, they're going to have the co-benefits of helping our communities in terms of population health today.